a measles outbreak here in California. Dr. Carson, Donald Trump has publicly and repeatedly linked vaccines, childhood vaccines, to autism, which, as you know, the medical community adamantly disputes. You're a pediatric neurosurgeon. Should Mr. Trump stop saying this?
Well, let me put it this way. There have been numerous studies, and they have not demonstrated that there's any correlation between vaccinations and autism. This was something that was spread widely 15 or 20 years ago, and it has not been adequately revealed to the public what's actually going on. Vaccines are very important, certain ones, the ones that would prevent death or crippling. There are others, or multitude of vaccines, which probably don't fit in that category, and there should be some discretion in those cases. But, a lot of this is pushed by big government, and I think that's one of the things that people so vehemently want to get rid of big government. We have 4.1 million federal employees, 650 federal agencies and departments. That's why they have to take so much of our taxes.
Should he stop saying it? Should he stop saying the vaccines cause autism?
Well, I've just explained it to him. He can read about it if he wants to. I think he's an intelligent man and will make the correct decision after getting the real fact.
Mr. Trump, as president,
I'd like to respond.
Going right to you.
I'd like to
Mr.
respond.
Trump, as president, you would be in charge of the Centers for Disease Control and the National Institutes of Health, both of which say you are wrong. How would you handle this as president?
Autism has become an epidemic. 25 years ago, 35 years ago, you look at the statistics, not even close. It has gotten totally out of control. I am totally in favor of vaccines, but I want smaller doses over a longer period of time. Because you take a baby in, and I've seen it, and I had my children taken care of over a long period of time, over a 2 or 3 year period of time, same exact amount. But you take this little beautiful baby and you pump, it looks just like it's meant for a horse, not for a child. And we've had so many instances, people that worked for me just the other day, 2 years old, 2.5 years old, a beautiful child, went to have the vaccine and came back and a week later got a tremendous fever, got very, very sick, now is autistic. I only say I'm in favor of vaccines. Do them over a longer period of time, same amount,
but
just in little sections.
Dr. Carson.
And I think you're going to see a big impact on autism.
Dr. Carson, you just heard his medical take.
He's an okay doctor. Okay. But, the fact of the matter is, we have extremely well-documented proof that there's no autism associated with vaccinations. But it is true that we are probably giving way too many in too short a period of time. And a lot of pediatricians now recognize that, and I think are cutting down on the number and the proximity in which those are done.
And
I
that's
think
all
that's
I'm saying, Jake. That's
Dr.
all
Paul,
I'm saying.
Dr. Paul, I'd like to bring you in.